Hello friends, myself Dr. VEENA'S here with new topic today from medical surgical nursing, that is hypertension. So today we will see about definition of hypertension, risk factor of hypertension, types of hypertension, pathophysiology, some common signs and symptoms of hypertension, diagnostic assessment and management. Under management we are going to see goal of management, medical management, nursing management, and then prevention and dietary management for patient with hypertension. So let us start with the topic. So we will see definition of hypertension. What do you mean by hypertension? Hypertension, that means increase. Hyper is increase. Tension, pressure. Which pressure? Blood pressure. Increase in blood pressure or rise of blood pressure. How much? It is 140 by 90 mm of Hg. 140 is systolic blood pressure and 90 is diastolic blood pressure. What is systolic blood pressure? When heart is contracting, it is called as a systolic blood pressure. And diastolic blood pressure when heart is relaxing position. And normal blood pressure is 120 by 80 mm of Hg. But what happens in hypertension? There is increase, persistent increase in blood pressure, that is 140 by 90 mm of Hg or more than that. So it is called as hypertension or high blood pressure. Now we will see risk factor of hypertension. So when we talk about the hypertension and its risk factor, it is categorized under three headings. First is a non-modifiable risk factor, modifiable risk factor, and third contributing risk factor, or we can say health risk related or lifestyle related risk factor. So three types. First is a non-modifiable. We cannot modify this risk factor. Like for example, age, increasing age will have a hypertension. Gender, it is said that it is common into male as compared to female. Some of the study shows that the hypertension is very common in male as compared to female. Next is a hereditary or family history of hypertension. When there is a family history or parents or grandmother, father are having the history, that is genetic history or we can say hereditary history of hypertension in the family. So then next is a ethnicity. Ethnicity, that means area wise, like we can say the some of the people like in particular area or particular area of the country or area of the world, there is a specific people which have a prone to get the hypertension. So this is about the non-modifiable risk factor. Second is modifiable risk factor. That means we can modify or control and we can help own self to decrease the blood pressure. So like for example, stress. When there is a stress management has to be done to reduce the blood pressure. Obesity, lifestyle, smoking, alcoholism, and dietary factor like intake of more of the sodium, intake of more of the fried product or oily product, which leads to obesity and can lead to hypertension. Third one is a contributing risk factor. That means contributing to the risk of developing hypertension or further complications. So what are they? So first is a, like again I will say, dietary salt or dietary sodium intake. More sodium intake or less potassium intake, then stress, then there will be a lifestyle practices like lack of exercise, lack of activity, which is contributing to the diseases like hypertension or smoking, alcoholism. These are the some of the contributing risk factor. So we have seen risk factor like modifiable, non-modifiable and contributing risk factors which are responsible for developing high blood pressure. Now we will see types of hypertension or classification of hypertension. So in that first is a hypertension. What is hypertension? That means increase in blood pressure, that is 140 by 90. That means systolic and diastolic increase of blood pressure is called as a hypertension. Second is primary hypertension. What is primary hypertension? That means patient will have only hypertension. There will be no associated disorder. So increase in blood pressure, and it is diagnosed as a hypertension, that is primary hypertension. Third is a secondary hypertension. What is secondary hypertension? There will be some underlying disorder or underlying cause for hypertension like diabetes mellitus, renal failure, thyroid problems or heart problem, which leads to increase in blood pressure, and patient is diagnosed with some of the disorder called as a secondary hypertension. Fourth one is a white coat hypertension. White coat hypertension, that means it is commonly seen in the children's, like fear. Children may have a fear, and because of white coat, or we can say white uniform, they will have a temporary increase in blood pressure, that is white coat hypertension. Next is a pre-hypertension. Pre-hypertension, that means patient will have an increase in blood pressure, but it is not at the frequently there is no increase in blood pressure, but one stage before diagnosis of hypertension. Isolated systolic hypertension. So what is this? When there is a only increase of blood pressure, that is systolic blood pressure. Systolic blood pressure is what? When there is a contraction of the heart, that is highest blood pressure. If it is increased more than 140 by mm of Hg, it is called isolated systolic hypertension, where the diastolic blood pressure will be at the normal level. Next is a preeclampsia. What is preeclampsia? There is increase in blood pressure during the pregnancy or maybe immediate after the pregnancy, where decreased blood circulation to the vital organ, and then female may have increase in blood pressure, and it can be one of the complication during antenatal, during delivery and postnatal period. So preeclampsia. Next is a gestational hypertension. Gestational hypertension, that means when woman is pregnant and at the week of 20 there will be, after the week of 20 there will be increase in blood pressure, that is 140 by 90 mm of Hg or more than that, is called as gestational hypertension. So these are the some of the types of hypertension. So next part we will see sign and symptoms of hypertension or clinical features of hypertension, or it is also called as a clinical manifestations of hypertension. So initially the patient will be asymptomatic, that means there will be no symptoms, but when we measure the blood pressure there will be increase in blood pressure, persistent increase in blood pressure, that is 140 by 90 mm of Hg or more than that. If you check like morning, afternoon, evening time, or for few days there is increase in blood pressure. So along with blood pressure, increase in blood pressure, there will be a lethargy. Patient will have a lethargy, tiredness because of fluctuation of blood pressure. Patient may have a vision problems. Patient may have insomnia, headache at the occipital backside, headache, occipital headache. Patient may have. Patient will be confused. Patient may have a nose bleeding. And in severe condition, patient may feel like breathing problems, dyspnea, or patient will be easily tired after doing some activity. So these are the some of the signs and symptoms of hypertension. Now we will see diagnostic assessment for patient with hypertension. When we talk about the investigation or diagnostic assessment, first is a history taking. In detail history taking of the patient. Like when patient is arrived, we have to take the past medical history, surgical history, history of chronic disorder, any other medication patient is taking, history about the risk factor, contributing risk factor, modifiable, non-modifiable risk factor. So in detail history of diet also we have to take. So detailed history is very important. Next we are going to have the physical examination. In physical examination, head to toe examination. Then specific examination, mainly basically chest examination, that is cardiovascular examination. Next, assessing the blood pressure and sign and symptom of hypertension. After these laboratory investigations, in laboratory investigation, complete blood count, then sodium and potassium level, serum creatinine, urea creatinine, then blood urea nitrogen, then lipid profile, we have to check, Then ECG monitoring, chest x-ray, CT scan, and some of the investigation depend on the underlying cause of the disease where the patient is having associated problem like blood sugar level, thyroid blood test and scan, continuous ECG monitoring and interpretation of that. Now we will start with the management of hypertension. So management of hypertension, first we are going to see goal of management. So what will be the goal of management? First is control the complications. Because of hypertension, if there may be any complication like cerebral bleed or heart problem or any other chronic problem, or patient may go in complication, we need to control it. Control of the complication and prevention of high blood pressure and control of high blood pressure. So this will be a goal of management. Next, we will see medical management. Under medical management, pharmacological management, dietary management and therapeutic management. And then next we are going to see nursing management, prevention and health education. So first is a diuretic. So what is the action of diuretic? Diuretic will help for the excretion of excessive fluid and sodium from the body, and ultimately it will help to reduce the blood pressure and acting on the renal area. Some of the examples or categories of diuretics are potassium sparing diuretics, loop diuretics, thiazides and related diuretics. And some of the examples of these diuretics are like mannitol, furosemide. Next is a beta blocker. So what is the action of beta blocker? It will have a effect like adrenergic effect on the cardiovascular system, arteries, and which will help to reduce the heart rate of the patient and will reduce the stress on the cardiovascular area. Some of the examples for beta blocker: atenolol, bitalopropol, etc. Next drug given for the hypertension is calcium channel blocker. So what is the action of this group of the drug? Mainly it helps to decrease the blood pressure by dilating the arteries and veins and will improve the blood circulation towards the heart. And some of the examples of calcium channel blockers are amlodipine, angiotensin converting enzyme inhibitor, which are helping to lower the blood pressure by dilating the arteries. And some of the examples of these like ketapril, metapril are some of the example of angiotensin converting enzyme inhibitor. Next is angiotensin 2 receptor blockers, and these type of drug also help to reduce the blood pressure by dilating the arteries. And common example is losartan and telmisartan. Now we will see pathophysiology of hypertension. So under pathophysiology, first we will understand the normal mechanism. So what is blood pressure? The definition of blood pressure, that is a pressure exerted by blood on the vessel which it flows. So whatever pressure is exerted on the wall of the arteries, veins, or we can say vessels, through it flowing through the veins or arteries is called blood pressure. So when we can say it is a systolic BP and diastolic BP during the ventricular contraction, when the heart is contracting, ventricles are contracting, and then blood pressure is measured during that time is called systolic blood pressure, which is the highest blood pressure, that is normal 120 mm of Hg. Diastolic blood pressure during the ventricular relaxation, when the heart and ventricular is relaxed, and diastolic blood pressure is a low paced blood pressure and normal is 80 mm of Hg. So what happens? Blood pressure is regulated by mainly two factors. Main is blood flow and second is peripheral vascular resistance. Blood flow within the veins and arteries, or basically we measure the pressure during arterial flow and peripheral vascular resistance and venous return. Next, what will happen? There is a dilation and constriction of peripheral arteries. Whenever there is a dilation and constriction of peripheral arteries, there will be a several mechanism to control this mechanism of pathophysiology. So there are mainly two factors or two systems we can say which are helping to control this mechanism of dilation and constriction of peripheral arterioles. First is a sympathetic nervous system and second is renin-angiotensin system. So what is sympathetic nervous system? It has a function of passing the impulses and control the blood pressure or mechanism of dilation and constriction. And renin-angiotensin, mainly it releases some of the hormones we will see later during the pathophysiology. So renin-angiotensin balance. So what happens? There will be a medulla which is present into vasomotor center. Medulla is an important or major part in the brain, that is called vasomotor center, and it is stimulated by baroreceptor or psychogenic stress. Some stimulus like the psychological stress or any negative reaction, and then stimulation of baroreceptor. And then there will be impulses are carried out through the sympathetic nervous system because of this psychogenic stress or some of the stimulant, for example stress. So impulses goes to the through the sympathetic nervous system. Then what will happen next procedure or step of pathophysiology? There will be release of catecholamine. Release of catecholamine, for example nephrin and norepinephrine. These are the two catecholamine released after this stimulation, and these are secreted by adrenal medulla and released from postganglionic nerve fiber. What happens? There is release of catecholamine. For example, nephrin and norepinephrine, and these enzymes are secreted by adrenal medulla and released from postganglionic nerve fiber. Then this mechanism is divided into now two parts. First is related to vasoconstriction and second is related to blood vessel constriction. When there is a vasoconstriction, that is constrictions or narrowing of the vessels, there will be a ventricular contraction. And which leads to increased cardiac output. When there is a increased contraction, ultimately cardiac output will be increased. Second side, there is a blood vessel constrictions, which leads to blood vessel constrictions, and ultimately there will be increased peripheral resistance, and then this mechanism lead to increase into blood pressure. Next is a dietary management. In dietary management, basically hypertension, it should be advised that low cholesterol and low sodium diet. So we need to find out or advise the patient and family members low cholesterol diet and low salt diet. So low cholesterol in the sense there should be some product should be avoided, like the fried food, then oily food, much of the fried food or non-vegetarian food or cream of the milk, which includes the high cholesterol. So low cholesterol diet has to be advised, like vegetable, fruits, multigrains, salad and all. Low sodium diet, that means patient should have a low sodium salt in the diet, then decrease the pickle, papad or salted fish. So low salt diet. This low cholesterol and low salt diet will help to reduce the blood pressure and obesity. Next is a prevention and control of hypertension. So here there are some tips to control and prevent the high blood pressure. It is said that eat a heart healthy diet. Eat a heart healthy diet including potassium, fiber and drink plenty of water. That means whatever is healthy for the heart, like low cholesterol, low sodium diet should be included into diet, and there should be a excess amount of potassium, fibers and lots of water. Second point, exercise regularly, at least minimum 30 minutes of walk and exercise. Along with that, pranayam, some of the practice of alternative therapy, active and passive exercise depend on the condition. It is must, and it should be a like daily routine. Quit smoking and alcoholism, it has to be avoided. As we have seen in the risk factor, smoking and alcoholism leads to hypertension, so it has to be totally stopped. Then limit the amount of sodium to eat, which will help to reduce the blood pressure. As sodium is increasing, there is increasing in blood pressure, and it should be very less than 1500 milligram per day minimum requirement, and it should be like less than that if the patient is having severe hypertension. Reduce stress, which will help to reduce the blood pressure. So try to avoid the things that causes the stress for you, and you can also try meditation, yoga, pranayama, alternative therapy, music therapy. So try to reduce the stress with the stress management. Then stay at a healthy body weight. That means weight management. Reduce the weight. Like you should avoid the food product like less amount of glucose and the fatty product. Regular exercise, which will help to reduce the stress. So this is about the prevention and control of hypertension. Next we will see complications of hypertension. In complications of hypertension, there are so many hypertension complications, because if precaution is not taken, risk factors are not avoided, and proper treatment is not taken, patient will end up into some of the complications like aortic dissection. Aortic dissection, that means there will be a problem with the aortic valvular contractility and cardiac output. Arteriosclerosis, that is deposition of fat within the arteries. And next is a brain damage, when there is increase into high blood pressure, severe blood pressure, it may lead to intracranial bleed and then brain damage. Congestive heart failure, if chronic hypertension, untreated hypertension leads to overload on the heart, leads to congestive heart failure. In chronic kidney disease, mainly it is a secondary after hypertension. Heart attack, because of again atherosclerosis and sudden increase into blood pressure. Then hypertensive heart disease, peripheral artery disease, complication during pregnancy if it is a gestational hypertension, or preeclampsia, stroke and vision loss. These are some of the complications of hypertension. Next we will see nursing management for the patient with hypertension. So I have listed major nursing diagnosis, and accordingly we'll see the nursing management. So first nursing diagnosis, discomfort related to headache secondary to high blood pressure. So here expected outcome will be patient will verbalize relief of headache by evidence of normal blood pressure. So we are going to plan the intervention for this. Assess the discomfort, assess the pain, that is headache, give comfortable position to patient, measure blood pressure, diversional therapy, medications, stress management for the discomfort related to headache secondary to high blood pressure. Second nursing diagnosis, altered sensory function related to confusion. So here confusion will be there because of hypertension. Expected outcome will be patient will have a normal sensory function by evidence of relief of confusion. So here we are going to assess the sensory function of the patient, assess vital parameters, assess patient's mental condition, any contributing cause which leads to confusion, adequate rest and sleep, and treatment for hypertension. Next, altered sleep pattern related to fatigue and headache. So expected outcome will be patient will have a sound sleep by relief of headache and fatigue. So assess the sleep pattern, provide the diversional therapy, monitor vital signs, provide the soothing, calm, quiet environment to the patient, and stress management. Next, alter nutrition more than body requirement related to dietary restriction, or it can be a altered nutrition less than body requirement related to dietary restrictions. So here assess the expected outcome will be patient will have a normal nutritional pattern as evidenced by low salt and low cholesterol diet. So assess the nutritional pattern of the patient, assess likes and dislikes, advise the patient which food to be reduced or avoided and which food has to be taken. So this is about the nursing management of patient with hypertension.